Welcome to all of you. Good morning for those in the US. Good afternoon for those in Europe. We're delighted to welcome you to the Global Economic Challenges Network. Over 600 of you have signed up and you're joining as we're going by hundreds, so delighted to have you all. A couple of words before we start on GEC, the Global Economic Challenges Network. It's an initiative spearheaded by Georgetown University and Université Libre-Belgique, ULB, along with many other prominent institutions. And it was created with the ambition of facilitating discussion on important economic challenges facing our world. The network sponsors a series of international workshops that bring together leading scholars and policymakers to discuss the pressing economic problems of our century, and we've got a couple these days, so we will be looking at. When we started, we launched in November 2019, and our first workshop was on the future of labor. At that time, we did not expect that in less than 6 months, we would be living a global shutdown of world economy, a world economy on pause. And today, we're really delighted to have brought together a very distinguished group of economists, immunologists, and policymakers from the public and private sector to discuss how we can and when push the button on and reopen the world's economies in the presence of COVID-19. We have around an hour and 15 minutes together. We will start with our distinguished panelists who will share their perspectives. We have a special guest joining us. In French, we would say le grand témoin. And then we will open to Q&A with our panelists, but also with the audience. Just to start, a very special thanks to Frank Valle from Georgetown University and Michel Castanheira from ULB for taking this initiative, organizing this, coordinating and bringing us together. And Yvonne Queck, who's been key in making sure all of this hopefully runs very smoothly during this hour. To start off, I would like to present to you Michel Goldman. Very honored to have you with us, Professor, today. Michel is a renowned immunologist. He received in 1992 the Medical Prize of Lucien Steinberg, and in 2000 the Quinquennial Prize of the Belgian National Fund for Scientific Research for Clinical Sciences. He's been really leading a lot in the past couple of years, especially co-founding the I3 Health Institute that we will hear a little bit more about. And in looking at starting off, I think the session with really the big question is, what is the rational use of COVID-19 tests? And thank you so much, Michel, being with us. Very honored to have you and very happy to start off with an immunologist for our economic network, really.
So thank you very much for the introduction, and thank you to all of you for having me. It's really an honor. I think that indeed to understand the economic challenges, it's essential to also understand first the medical challenges. And as you will understand, uncertainty is also in the medical field. However, there are a number of things that we know that I would like to share with you, especially the point which I think are highly relevant when we discuss about exiting the lockdowns. So I will start by discussing what's really the major differences between usual flu and COVID-19. Remember at the very beginning, some people were saying, oh, you know, it's just like a flu. As you know now, it's not like a flu. However, sometimes it is really a flu-like disease. Actually, in 80% of the case, COVID-19 is either not causing any symptoms or only very mild symptoms. It's only 20% of the cases that it's really a very serious, severe disease. And as you know, actually, the lethality is 20 times higher for COVID-19 than for flu. The other difference is the diversity of symptoms. Obviously, flu can also cause lung disorders, pneumonia, like COVID-19. But the more we learn about the disease, the more we realize that the clinical expression of the disease is really multiple. Just to give you one example, we know that stroke might be a presenting event of the disease, or pulmonary embolism, etc. The other difference will certainly be the long-term consequences of the disease. This is a very important point also for your discussion. We have to realize that there will be a number of people, especially those who suffered from the severe forms of the disease, who will develop long-term chronic lung disorders or heart diseases or kidney diseases. And probably the most important long-term consequences might be on mental health, and this is something important to consider. The other huge difference is obviously the fact that COVID-19 is highly contagious. The transmission of the virus is much more efficient, I would say, than for flu. And this is related to two different reasons. First, the way it is transmitted like flu with droplets, but also the virus can be, in some cases, airborne. Also, we know that actually some environments are especially dangerous in facilitating virus transmission. For example, just recently it was realized that slaughterhouses might be an environment where the virus will spread very efficiently. And actually, when someone is infected, its ability to transmit the virus might be quite variable. Actually, it is so that only 20% of the infected individuals will indeed transmit the virus. And there are even, and that's very important to know, super spreaders. And obviously there is a lot of attention to those people. This will be extremely important to identify those people, especially when we exit the lockdowns. Actually, what is important to understand is that to organize a responsible exit of lockdowns, a science-based exit, we have to move from, this overall lockdown to much more targeted strategies. So we have to identify who is infected. We have to identify the environment at risk. And it's there that indeed tests are so important. There are two types of tests which detect the virus itself, but this test was not available at the peak of the pandemic. And also there are quite a significant percentage of false negative PCR tests, this test for the virus, about 30 to 40%. So it's there that the serological test, which detects antibodies, might be important, because most of people infected will develop between 2 to 4 weeks after the infection, the symptoms. They will develop antibodies that can be rather easily detected by these serological tests. Now, one important question is whether those antibodies are protecting against a subsequent infection. This is not clear yet, although there is good evidence that they might be. However, and that's important, it's quite clear there is agreement now that the so-called immunity passports should not be used at this stage to guide the lockdown exit. However, again, those tests are very important to identify the people and the environment which might be at higher risk for virus transmission and virus spreading, I would say. So those are some of the elements that I was willing to share with you, which I think might be important when we will consider, the economic approaches.
Thank you so much, Michel. We will be continuing with Luigi. Just before, for the audience, if you have questions, there is two great means to be giving them to us. One is through the Q&A on the channel of the Zoom, and the other is through Twitter using hashtag GEC Network, hashtag GEC Network. Luigi, thank you so much for joining us today. We will, will be talking to us about unlocking the lockdown. Luigi Guyuso is the AXA Professor of Economics at the Economies Institute for Economics and Finance. Previously Finance Program Director at the Center at CEPR, the Center for Economic Policy Research, who's also been a partner for us. He's specialist in household finance, culture, and economics, and especially labor economics. And today, I think the big question of how do you actually unlock the lockdown, and what are the main challenges that you see, and how do you see the governments dealing with it?
Thank you very much. It's a great pleasure to participate in this discussion. As you can easily understand, I'm not an expert in pandemics, not even in pandemics economics, but there has been, a very fast adaptation on the side of economists to the current crisis, despite of the lack of previous experience. So the issue that I'm going to talk about is how to exit from the lockdown. And let me start by noticing that there is a fundamental important asymmetry between locking the economy and then unlocking it. And the very fundamental issue is that locking the economy is relatively easy. Unlocking it is much more difficult. This is not to say that the decision to lock the economy, to stop the economic activity, is one that you take, so to speak, with a kind of easiness. It's a super tough decision, but I'm saying that in terms of alternatives, there is not much that you can. There are not many alternatives that you can consider. And the easiness essentially comes from the fact that you have to follow an easy criteria. Lock down everything that is not essential for survival. And essential we can easily list is food, is energy, is communication, is the transactions industry, clearly the health sector, and the government. You need a government in order to manage the crisis. And secondly, there is very, very little room for disagreement, for political controversy, because when you decide a lockdown, you do it at the peak of the crisis. And, the decision is essentially triggered by the timing that is imposed by the speed at which the virus is progressing. So it's very difficult for any political opposition to make a big issue, with exceptions clearly, in countries where the political parties are sort of tiered apart. Unlocking instead is much more difficult, essentially because you would like to unlock everything, but you cannot. And the reason why you cannot is for the reason that Michel was mentioning earlier on. There is a lot of uncertainty when you decide to unlock. You do it when the virus seems to be a little bit less dangerous, but you don't know how much. And so the only criteria that we can use is a sort of gradual strategy of exiting from the lockdown. Then the question becomes, if it is gradual, who should start first? Where do you start from? Which industries, which sectors should be opened up first? Secondly, there is a lot of room for disagreement. The political controversy here, kicks in again. And the reason is that you start unlocking when the curve has already flattened. So the virus seems less dangerous. So there is more time for procrastination and for debating and for discussion. And secondly, because everyone, after a couple of months of freeze, wants to unlock first, so there is room for, for political representation. Now, clearly, as Michel was mentioning, there is a lot of room for targeted policies, both in the face of, the lockdown and also in the lockdown phases. And we know that, there are lots of potential gains if we can target relatively well, and separate workers that can work safely from others that you want to protect. And for instance, one criteria that has been proposed both for the locking and the unlocking is to rely on age. So, send to work the younger that are less prone to contract the virus. If they do, the consequences are relatively mild. Then keep on the elderly, let's say the people that are 65 or above. The problem here is issues of implementation. So, for instance, the separation of the elderly from the young in some social structures can be extremely difficult. In my country, in Italy, it's difficult. Secondly, there are issues of discriminatory policy. It was proposed in Italy, it didn't go through. Essentially because they said, you cannot discriminate the elderly, you cannot discriminate according to age. So you need a sort of framework that is acceptable in order to unlock the economy. Take into account that, as I said, there is risk when you unlock, so you need some gradualism in order to understand whether the unlocking is viable, whether the virus starts spreading again or not. And secondly, given gradualism, you need a criteria to say who should start first. And my idea is that, it's a very practical idea that I've been discussing with my colleague, Matteo Paradisi. Essentially, you should reopen sectors that have a high economic value, and at the same time, workers, naturally, technologically speaking, they are characterized by higher social or physical distancing. One way of measuring economic value is, for instance, looking at the centrality of the industry, the centrality of the sector. Essentially, a sector is more central if the production of that sector enters into the production of many others. And so becomes important at the restarting stage because it's indispensable for others' production. Another is export dependence. If sectors that are highly exposed to the global market, the absence from the market for a long period of time can be extremely costly and sometimes may not even survive. And that is particularly important for relatively small open economies like Italy and Belgium, for instance. This is easily measurable in the sense that you can measure centrality, you can measure export dependence, and there is plenty of heterogeneity across sectors, ranging from 0 to 50 or 60%. Similarly, there is a lot of heterogeneity in social distances, in physical proximity and reliance on telework across different industries. So, for instance, if you look at the data, you can see that certain sectors, they allow jobs to be physically distant, to colleagues that don't need to be working close to each other. The slaughtering industry is the opposite example, where workers have to work next to each other, and that's why the virus tends to propagate so easily. The other is the feasibility of working at home. Then you can put these two measures in a single index, and see whether, and combine with the other criteria, which is the economic importance of the sector. And you can, I was looking at the data for Italy, but one can apply the same methodology for other countries. And what you see is that there is a cluster of industries that are high economic value in terms of centrality or in terms of export dependence, and at the same time, the share of workers that can work at a distance is relatively large, or the proximity of the workers is relatively, the physical proximity is relatively low. So one should start exactly from those sectors in the unlocking phase. Ideally, one should have used the same criteria also during the locking phase. Those were sectors that were of high economic value, and if you wanted to contain the economic cost of the lockup, that was a potential criteria. At least in Italy, it was not one on which the government was leveraging. But if you look at what the government is doing today, it seems that it's following a strategy of the sort. That is, they have started to open up in phases of 2 weeks, distant of 2 weeks distancing from each other, and they have started exactly from the industries that are of high economic value and that score low in terms of physical, score high in terms of physical distance of the workers. And I think this is sort of good news. So I would, for the moment, stop here, and then we can discuss other issues that are related later on to, to the opening up of the economies.
Thank you so much, Luigi. Absolutely, we'll come back as some of the points you make, I'm sure, are going to create also questions around inequality in other areas, and we'll discuss that. This is a great transition for the next panelist talking to us about protecting employment and promoting reallocation. Giuseppe Moscarini, you're joining us from the US, from Yale University, because you've got a big Yale behind you, so we see that. Wonderful, thank you so much. Giuseppe is professor of economics at Yale and co-director of the research program in macroeconomics at the Coles Foundation in Research Economics. He's been editor of several academic journals, and he's been working obviously around macroeconomics and information economics. I think there's a great transition into how you see the unprecedented shock it has brought to the labor market, and how you're analyzing it from where you are sitting, especially from the US. Thank you, Giuseppe.
Thank you. Good morning. Let me thank again Frank and Michael for putting this together. I think they understand the importance of bringing research to bear on policy and to do this carefully. So what I'd like to talk about is what's been done in the labor market to implement policies and what should be done. So this shock is very unusual. It's very large. It's also very temporary on some dimensions. Think haircuts. People will go back to haircuts right away. It's also very persistent in other dimensions. We know that leisure, hospitality, and travel will be affected for a long time. And so the question is, what should labor market policy do, given we have two conflicting goals? So on the one hand, we'd like to protect employment from this temporary shock. On the other hand, we have to reallocate employment to some activities. Okay? There's no way around this. So why should we protect employment? So we think, from my research, the main reason to protect employment, as well as supply chains and customer base and so on, is that employment contains a lot of what we call matching capital. So for workers, the main source of wage growth over the career is job shopping. You just look for the best match. So think about the job ladder that you're climbing. The bottom rungs are slippery, and then you climb them, and you're more and more productive and better paid. And if you fall from the top, it hurts. At the top, people are very productive. So society has a lot to lose from dissolving those matches. In addition, not only you find the good matches over time, you also learn how the firm operates. You learn how your colleagues are, you know, the commuting, the corporate culture, and so on. And there's a lot of evidence for that. So, for example, you know, in my past work, I showed that. So I was actually an expert on recall, which was like an obscure issue that now has become, you know, prominent, because the question is how many workers are going to go back. So what we do know is that when workers go back to their company, they do a lot better. Even if they did not expect to be recalled, there's a lot of this kind of specific knowledge that is already there, immediately regained. And if you don't go back and you fall off this job ladder, it hurts a lot, not only on impact, it actually hurts for many, many years. So we are talking about you know, losses in the order of 10% of lifetime earnings if you get laid off from a well-established career. And again, the same applies to you know, customer base and supply chains and so on. Now, this is not just about the worker. This is about specific human capital that gets lost and society loses. Okay? Many policies in place. So, you know, the Kurzarbeit in Germany, Cassa Integrazione in Italy, and, you know, chômage partiel in France, and the same job retention scheme in the UK, or the Danish scheme, they basically protect between 80 and 85% of wages. And what they do, they freeze employment in place. Now, as we reopen, many of these policies are still in place. Okay? So the UK policy was actually prolonged to October. So, you know, this is kind of freezing employment in place maybe for too long. Now, the US did not have a system for wage subsidies of this kind, but they have an unemployment insurance system. And they introduced the Paycheck Protection Program, which gives companies a loan that will be forgiven if they rehire their workers. Okay, the goal is the same. Let's save this matching capital, because if we lose them, we have to search for workers and retrain them, and they will shop and they will go through different, you know, jobs again. It's going to be a big loss in productivity. So here we're also concerned about the medium run. Okay, the propagation of the shock and the poverty and the reduction in welfare that we choose. There's a second goal, though, as I mentioned, which is reallocation. Now, reallocation is very important to society's welfare. Okay, just like, you know, living organisms have to replace dying cells, economies only thrive if they allow firms to close and workers to move, and business deaths and births and so on. So dynamism is essential to productivity growth. And this churning in normal times is enormous. Even in relatively rigid labor markets like Europe, these are very big flows. Okay, hundreds of thousands or millions of people every month change jobs, you know, retire, become unemployed, and find jobs and so on. So, you know, there's this notion that these flows are almost as large as the stock of unemployment every month. Now, in the US, which is a very dynamic labor market, about 1 employee every 16 every month separates from a job. So these are very big numbers. Now, right now, there are clear needs for reallocation. Okay, and without going into the details of who needs to be helped, you can just look at new job openings. So which new jobs are firms, you know, posting? Those are very forward-looking measures, okay? Because firms are thinking about, should I look for a worker and train the worker and so on. So, for example, new job openings in March, at the end of March, already collapsed in the US in many sectors. The US has a monthly survey, and the UK has a similar survey. They already collapsed in many sectors, but not, for example, in retail trade, in healthcare, or in government. So those are obviously sectors that need you know, employment, not just because we think they do, but because they say they do. So we just can let the market speak there. Okay. So we have basically a policy proposal, and by we, I mean myself and 2 co-authors, Shigeru Fujita from the Philly Fed and Fabien Salvinet from University College London. We elaborated in a couple of columns on Vox, which is the CPR column publication. And so first, we kind of emphasize the importance of saving this matching capital, because there's a lot to lose for everybody. So imagine if you have to find again your dentist, or you have to find, you know, a new career. I mean, it's just a massive waste that we're trying to avoid, but we have to get people moving at the same time. We have to move them to the expanding sectors. And so we propose to actually use indirectly age as a criterion, although the implementation will not have to be on age. The basic point here is that health risks for young people are not small, they're minuscule. And so as of yesterday, just check the data, as of last week, no teenager in Italy has been reported to have died In the US, under the age of 24, 88 people died as of yesterday. 88 sounds like a lot, but these are 100 million people. In 2009-10, the swine flu, I checked, killed 1,400 people under the age of 24, and no one remembers that. So this risk is very small. Now, at the same time, so this gives us an opening. At the same time, what we do know from labor economics is that young people move a lot. They change jobs a lot. Okay, so the probability of changing job every month for a person under the age of 35 is at one order of magnitude bigger than for people like me. Why? Because, you know, I look for my career, I kind of settled in my career, was selected, I find the job I like, I learned how to do my job with my colleagues, and young workers are still doing that. So there's less matching capital to save there. So the proposal is to identify different sectors defining by essential, whether the demand is affected by distancing, whether it can be telecommuting, the hazardous. We don't do this classification. You know, Luigi explained one. There are several ones out there, and I think they're all converging. They're very specific. Okay, so they detailed, there's a detailed description of each sector by one of these 4 characteristics. And then we propose to try and protect experienced workers in the temporarily affected activities with furlough subsidies. So experienced workers have a lot of human capital in the activities that will bounce back quickly. Let's just make sure they don't kind of go away. Okay, they stay with their firm. For experienced workers in the permanently affected activities, that might not be a great idea. So then, you know, more generous unemployment insurance benefits to support them will help. In the US, there has been a massive wave of early retirements with an enormous increase in non-participation, which seems to be a lot of early retirements, which has kind of a similar flavor. But then we also have to push, you know, younger people to feel the relocation needs. And so there, it's clear that some wage subsidies in some sectors will work without actually tailoring to age, because if the job is a bit risky and there's a wage subsidy, presumably is the young workers will line up and be willing to fill them. So the bottom line is there are policies in place, there are blanket policies that were designed a bit in a rush. They have to be tailored more to the relocation needs quickly. Otherwise, the shock will go away, we'll find a vaccine, and we'll be stuck with 5-6 years of slow growth and poverty, just like we did after 2008. Thanks.
Thank you so much. A lot to think about and many questions, but we'll be coming back. I'm really delighted we have Matthias Watry joining us for a lot of different reasons. First of all, Matthias has a very impressive career. He's the General Secretary of Danone, the large French multinational in food. Prior to that, he was Deputy CEO of SNCF, and he was Chief of Staff to 2 of the French mayors, Mayor Delanoë and Mayor Hidalgo. What's great having Matthias with us today is he's on the front line as the private sector, dealing with this and trying to see how to incorporate this also as part of the corporate social responsibility. And the case study of Danone has really brought a lot of, I thought it was quite fascinating reading through your experience. Matthias, thank you for being with us, and I'll let you start telling us how you're dealing with this.
Thank you, Shéhérazade. Good morning, good afternoon, and good evening, everyone. I wanted just to say first that this crisis is obviously a tragedy, but could be also an opportunity to reboot the economic system. And CSR in this current period of time is not a constraint. It should be like a compass. At Danone, for instance, during the crisis, Danone, we do have 200 factories all around the world. We do operate in more than 100 countries, and we do have 100,000 employees all around the world. We have 3 main activities: waters, dairy, and specialized nutrition. During the current crisis, we were defined as a priority sector, which means that, for instance, in some countries, we needed to activate some food corridors, and we needed also to have a freedom of movement for trucks or for employees. It was very tough. It was, and it is still really tough to have a kind of business continuity, because for Danone, business continuity is not just the turnover issue, it's also the continuity of nutrition all over the world. And this is the reason why it was really a very strong activation of all our employees all around the world. But to do so, we had to protect our workers. We protect them obviously with sanitary measures, but we protect them also on the social standpoint. First, we have guaranteed all the wages, 100% of the wages all around the world, whatever the activity is. We wanted also to guarantee some child care and health care coverage for all our employees all around the world. And we wanted also to have a specific bonus, especially 1,000 euros in France, for workers that were very in the frontline situation. When it comes to the ecosystem and all the economic partners that we have, Luigi spoke about that, we had to activate 300 million euros because we did know that we have weak suppliers, weak customers in our ecosystem. And we needed, as a multinational company, we needed to protect them. It's not just a matter of ethics, even if it is an ethical approach, but it's also a matter of business. We wanted also to define what is a weak member of the ecosystem, and we have identified 15,000 stakeholders that are in our ecosystem. And at least we also had a lot of donations. We make for 6 million euros of donation. We have distributed more than 32 million of products for people in a very tough economic situation. And at last, what we wanted to do also is, as a feedback of such a crisis, is to be a purpose-driven company. And we have decided few days ago, because of the current situation, also to become a société à mission, which is a specific status in the French law, which means that we are going to have our social and environmental mission into the status of the company. And this is something very important. We are 30% of our companies that is certified B Corp. We will be 100% B Corp by 2025, but we wanted also to be a purpose-driven company. And this is one of the feedback of this current situation for a company like Danone.
Thank you so much, Matthias. I think the example of Danone of both taking care of its employees and the collective and ecosystem was, at least for me, quite interesting, which we're very happy and we're very lucky to have with us today Matthias Watry. Thank you so much for joining us. Matthias is one of the founders of Economies, the Economic Research Center of ULB. He's been working quite closely with Jean Tirole, the Nobel Prize in Economics, and Eric Mascan. Most recently, his academic work with Jean Tirole on the prudential regulation of banks induced him to become the vice governor of the National Bank of Belgium. And he is now back at ULB, where he founded I3H with Michel Goldman, the innovation hub. And his most recent research has been focusing on the economics of health. And it's because of this unique experience between the frontier between health and economics that the Belgian government asked them to join the GES and advise them on the reopening of the economy. And just as with Matthias Watry, the on-ground experience of the corporations dealing with this, Matthias, our second Matthias here, has the experience of actually how the governments are doing the decision-making. And since you were involved in the reopening of the Belgian economy, very curious to hear from you, since you were an advisor, on what were your main concerns on the what, the when, and the how to reopen?
Well, thanks a lot, Shéhérazade. Thanks a lot to the organizer for inviting me. Just a small correction, it's not me, but Michel who founded I3H, the Institute for Interdisciplinary Innovation in Healthcare. And in fact, it's Michel whom the Prime Minister wanted to see in order to be to understand better various dimensions of the crisis that gave the opportunity of Michel to suggest me as part of this group. So that's why I ended up
Thank you for
there.
the clarification.
And it was based on joint work with Michel and others on testing and on exiting the lockdown. That in fact that my credibility, in a sense, in that group of 10 people, that includes 3 virologists, 2 epidemiologists, the governor of the central bank, a businessman, a social sector person, and a lawyer, and me. And so it's quite interesting to be in this interdisciplinary environment on this group, for whose key mission, which started a month and a half ago, was to sequence suggest ways to sequence the lockdown exit, balancing sanitary and socioeconomic risks. Now, what I'm going to say is pretty consistent with what was said before. In fact, indeed, Michel is completely right to stress the importance to accompany the exit with proper testing and tracing, so as to be able, in case of flare-ups afterwards, to have very targeted kind of reconfinement, because indeed the current one, which has been necessary because of the crisis, is extremely costly. So that's very, very important. Also very important indeed, trying to understand what is temporary and what is permanent or more long-term. As Giuseppe mentioned, of course, at this point, it's extremely unclear. We don't know when the treatment would come, when a vaccine would come, and how efficient that would be. So we have to make decisions in urgency. This means basically that we cannot optimize too finely. We just have to see what can be reopened under good sanitary conditions. Also, I think, and I will stress that, very, very important is the political economy dimension that Luigi stressed. It's very, very important, as we will discuss. Our goal is to try and be guided by scientific evidence and to optimize, let's, modestly, between the various dimensions, so the sanitary and the socioeconomic dimension. We know that there are some general principles that are well established from a sanitary point of view. Outside activity is less dangerous than inside activity. Physical distancing is key, and hygiene. Face masks are useful, but they are no good substitute for physical distancing. And prolonged contacts are dangerous, much more than very short-term contacts. The political economy is very important, especially because there is confinement fatigue, and so the best rules are not great if they are not enforced. So here I will focus, given the topic, just on the work aspect, not the private life, which is also a very relevant dimension. My experience in the last couple of weeks is that the deconfinement push is really enormous. People are really, given the fact that it's very unpleasant, that it's very costly economically, there is really a huge deconfinement. The bias is in that favor. And that makes it difficult to enact rules and to keep rules in place. Also because I think there are very, very heterogeneous individual attitude towards the disease. Some people go all the way of dismissing it. That includes at time, by the way, people like the President of the United States. And others are really on the other dimension. And there are people, for example, who don't dare go for a chemotherapy session for their leukemic child because they are so afraid of going into a hospital, which is pretty irrational. There is a broad consensus that children have a much lower risk, which doesn't mean that they cannot be contagious, but definitely, indeed, very few children die from this disease. Now, this heterogeneity means that rules are difficult because there is always somebody who will complain that the rule is excessively harsh or excessively permissive. And that means that going for recommendations, which at times governments, including the Belgian one, go for, is attractive politically. But let's face it, externalities are still there, and therefore not having rules also has a cost. Now, as I said, given the urgency, there is only so much optimization you can do, and you have to be broad brush. One thing we did in Belgium was to say, okay, let's first go for business to business companies, reopen them, especially large ones. I think they are good candidates for an early restart because Belgium being a highly unionized country, you can basically use employers and unions as somehow competing advocates that can try and find the middle ground. Now, given temporary unemployment benefits, workers have more bargaining power. Now, so they can insist on sanitary rules, while companies will push, of course, for making sure that they keep making money. And not all companies are as enlightened, I think, as Danone, which I think is, by the way, with Michel and Alain Fischer, we wrote a paper on benefit corporations, which is what you are doing now, 100%, I understand. So we would like to talk to you about that, Matthias. Now, but as I say, B2B firms, I think, make sense for early reopening because you can monitor properly the sanitary versus economic dimensions. Now then, business to consumer, so shops in particular, followed, in my view, a bit early, in the view of our experts, a bit early, but the pressure was there. I think they are more problematic because the advocate for health is less obvious. I mean, you don't have the equivalent of trade unions in small shops, of course, and it's a bit unclear to make sure that everything will be fine. But okay, we did manage to have proper so-called protocols between employer associations and trade unions. I think these things are helpful to get also the political acceptance of the sanitary rules. Now, of course, this is an adverse, possibly long-term supply shock. It becomes more costly. You need more space to have physical distancing, all that. And so basically now we have not only the big demand shock, but also a supply shock for which, as was said by Giuseppe, temporary unemployment benefits are helpful, but only for the sectors that are not too affected long term. Some will have to shrink, readjust, move to online shopping and the like. And so these are things to be managed. Now, while business to consumer may move too fast, schools may be at the opposite end. I think the valid health concerns are well represented, well heard, because teachers and some parents indeed will want to make sure that things are safe. Maybe the human capital concerns, vital in particular for fragile kids, may be less well represented. And you know, there is short-termism. Okay, your kids are safe, but if they are not learning, this will translate into long-term problems. So, and the problem here, and there are big debates on that. There are many people who are worried about kids not going enough to school. But one thing which makes the debate difficult is that it's unclear to what extent children transmit the disease. And if it's unclear, people may take strong views, even though it's not scientifically based. In general, as I say, the push for reopening may be excessive. There may be a slippery slope problem That is, every reopening of an activity brings another reopening request by somebody who says, but you know, we are no worse than the others. Still, we have in Belgium, we are in the middle of the process. Cafes and restaurants, culture, religion, tourism, air travel are still not reopened, and this is for the coming weeks. On travel, there is an interesting new normal. Public transportation is less attractive now because it's crowded. Interestingly, they should in principle favor all the other types of travel: walking, biking, motorbiking, cars. So, which is a kind of a new cocktail, which is not easy, you know, green versus fossil fuel and the like. Interestingly, the green ideas are winning kind of in many places, including Belgium. So bikes and bike lanes are really hot. Another key, of course, to solving this problem of potential overcrowding of public transportation is working from home. And that's one thing that we try and push a lot. The problem is that I guess working at home is very popular in the population part-time, and very unpopular full-time, because indeed you want some social interaction that you get from work. And so we are now busy trying to understand to what extent we can keep the reopening going while maintaining proper enough working from home, which of course has a number of interesting organizational challenges and very kind of a wide-ranging impact potentially. So anyway, so these are the things I wanted to share with you. Thank you.
Thank you so much, Matthias. Thank you all. Thank you. I have a lot of questions are coming in, and I'm trying to put them together to be addressing. Some of them are. I will start with Giuseppe with two questions in one. One is, why do we need so many economic policies to do the whole reallocation? And specifically, one specific question as you're answering this, what about families and women who are childbearing years? How does that influence your proposal for workers to reallocate jobs and or locations? And then, you know, why so many policies since there's been a market failure? How much can you anticipate? So if you can answer some of that in 2-3 minutes, that would be great. So we can move on.
I'll be quick. So thank you for asking it. Actually, I think it's important to identify what a market failure is to design policies, you know, appropriately, just rather than a knee-jerk reaction. Now, for this intangible capital, we have to say the basic issue is commitment. It's, you know, it's hard for the firm to believe that all workers are going to be there, for the workers to believe that the firm will reopen, and they're all kind of not, you know, coordinating. So the government can provide commitment by providing furlough subsidies or, you know, forgiven loans. Now, for reallocation, the main issue is really externalities. You know, older workers not only are at high risk, unlike young workers, not only they die, which we want to avoid, they also fill hospitals. Okay, they take healthcare resources, you know, as Matthias said, from others. That's a big deal. We are discovering more and more what the opportunity costs have been of all this from the economic viewpoint. Now, younger workers probably will respect social distancing less, I would expect, because they know they're less at risk. They still face health risks, but they're less, you know, careful. So these are all externalities where people act in their own best interest and not in the interest of society. So we certainly need policy for those reasons. Okay, that's where the markets fail, and that's what we should address. Now, on families and women, government is one of the essential sectors, and schools should be the one essential sector to allow people to go to work and reallocate. And on implementation, there are many ways of doing this, but certainly don't have to make age explicit. You can start hiring, you know, new teachers with low pay, and you will attract young teachers, for example. And that will make it easier to send kids, you know, to school and for people to reallocate. So let me stop there.
Thank you so much. Michel, a couple of questions. First of all, why having these testing policies and how to make them more coherent throughout Europe? and the EU? And how would you manage that? I'm specifically for you a little bit linked as an immunologist. How do you look at the Swedish approach compared to that of the EU, other European countries, and the US? And how do you fit this all together? If you can answer maybe in those two questions.
Yeah, the first about the test is extremely important. Clearly, this has been said by the World Health Organization, by the European Commission. Actually, the Commission produced a roadmap for lockdown exit, but unfortunately, each country is adopting its own policy, basically. And that's really a problem, because it's clear that we have to know where the virus is. We have to know which and who are those people without symptoms and being infected. And for this, you need tests. It's the only way. And I explained the two types of tests, and also perhaps one day when the test will be more reliable, we will be able to use them to indeed to identify the workers which might be in more, I would say, risky positions. We are not there yet, but clearly to know who got the virus, who is currently having the virus, is a priority. This is exactly what Germany is doing. Probably Germany is one of the best examples around our countries. Since the very beginning, they really implement mass testing, and again recently they identify the best test to look for antibodies, which is commercialized by the firm Roche. It's very important also to make sure that the policy is consistent, not only in terms of number of tests, but also in terms of quality of tests. And there we have a huge problem, especially in Europe. We have a number of different tests with different sensitivities, with different specificity. And I would say it's a shame that we were not able to harmonize all this. Obviously, there are economic, financial considerations behind this. It's a huge market, but facing the challenge we are facing, we could hope that there would be some, I would say, more collaboration to rapidly identify the tests which are the most relevant. This is about the test. So indeed, we need more tests to indeed develop this targeted approach to, again, to identify where we should put the effort. And this we don't know yet. Regarding Sweden, I would say that the jury is still out. Obviously, in Sweden, they adopt a much more liberal policy. As you know, the death toll is significantly higher at this stage. But you know, we will see at the end of the pandemic, you know, what's the final results. And when I hear the discussion here, it's really interesting that our reasoning is about, you know, number of deaths, but you know, when you think about the public, the perception, you know, and I always say, if you have, for example, in our country, only 1 or 2 children dying from these very rare forms of COVID-19 infection, I'm sure that, you know, the public push will change, because obviously media will emphasize those cases. And actually, this is a problem that we have already now. We see the disease is less apparent, and when the disease is less apparent, obviously people want to move out of the constraints. And you will see when the time will come to use the vaccine, hopefully there will be even lower numbers of cases, and you will see that at this time it will be even more probably sometimes difficult to convince people to use the vaccine. You would have the vaccine today, everybody would like to get it, right? And you will see that when the vaccine will be there will be a lot of resistance. That's the public perception, which has a strong influence, and in my view, too important influence on the policymakers.
Thank you so much. Matthias, a question for you on how, and as we're talking about reallocating workforce, and as a global company, so what's your vision? what's going to be the future of your relation with the farmers and with the supply chain? So how do you see globalization post-COVID?
Yeah, thank you for this very important question. The first part of my answer should be that standalone position for a company is useless regarding the huge challenges that we face, especially health challenges, obviously food challenges, environmental challenges. This is the reason why we have built two different coalitions. The first one, One Business for Biodiversity, to tackle the loss of biodiversity in our plates. We launched that at the last UNGA. And the second coalition, which were very active during the COVID crisis, is Business for Inclusive Growth that we launched at the last UNGA, at the last G7, sorry. And we wanted to have this coalition to tackle inequalities. When it comes to globalization, I think that globalization as it used to be is dead, is definitely dead. For instance, in Danone, we are in a position to be a multi-local company and not a multinational company, which means, for instance, that more than 80% of what we sell in a typical country is already produced locally. Then we are a multi-local company, and I think this is very important when it comes to relocation issues and in relation to sovereignty, for instance. And this is my last word. I wanted to say also that one of the feedback of such a crisis has to do with health sovereignty, but also has to do with food sovereignty. When it comes to globalization, we need to reboot the production system because food sovereignty is something very, very important. It is not autarky, it is not protectionism. It's just the capacity for a country to be the right operator of the food supply chain and of the food organization in this country. And yeah, one of the feedback is first, relocation is key. And food sovereignty also is really key in the next phase of the globalization.
Thank you so much. I've got some more questions for you, but I'll come back. Luigi, one question is, and you mentioned it throughout as you were imagining the unlocking and the lockdown, the different sectors, the different age groups. How do you see the potential effects of the unlocking policies on inequality, which has already been quite strong? And I
mean, the impact of the pandemic on inequality is clearly massive. I mean, it's extremely heterogeneous across groups, both along the economic and the health dimension. So, and I think it's very difficult to to trace a balance at the moment. There are many implications, both in terms of inequality, income inequality, in terms of wealth inequality, over the short, over the medium, and over the long terms, and in terms of inequality of opportunities too, for the reasons that, for instance, Giuseppe was mentioning. So I think we cannot trace a balance on what will be the impact of all this stuff on inequality. That will be visible perhaps a couple of years from now. But there is one issue that I think is important in this along this phase of unlocking, in the sense that if one were to follow the path that was suggesting, start from the high values industries and the industries where the social distancing of the jobs in those sectors is feasible. The workers can work at the distance. Now, if you start from there, that means that the occupations, other type of occupations, would be delayed. Like bars, for instance, come later. Firms in the tourism industry, they will come later, and that means that they will be locked down for longer. Workers in those sectors, in those industries, will pay a higher toll in terms of the length over which they will be locked, and impossibilitated to work. And so they suffer more. And there is a clear correlation if you look at the level of wages, the remuneration, and both the economic value of the sectors that are high in the export share, typically wages are higher. The same is true for more central industries. And also in terms of social distancing. So for instance, occupations that are in the top 20% of the wage distributions, essentially 80% of the workers can work from home. These people like lawyers, university professors, researchers, people in the public sector, and so on and so forth. And people that are in the bottom 20% of the wage distribution, they typically, they score much lower in terms of distancing. So teleworking is not doable for them. So if you are, working in a bar, you belong to the bottom 20% of the income distribution, and you have to show up and work together with your colleague, which is half a meter from you. So, and these people, will be the ones that will suffer the most. So my impression is that at this stage, one needs to think about some type of compensation scheme for workers that belong to those industries that is specific to this type of workers.
Thank you. A question for maybe Giuseppe and also Matthias de Watry on small from the audience here. Small but also large international companies are going to be in difficulty. For a government, a state, what should be the conditions, the criteria to support a company rather than another? There's been, I know in France, there's been some questions, and why is this company being helped? There's private equity money in it. And so, but there are workers also. How do you see that government help or state help? I don't know if Giuseppe, you want to start?
Yeah,
and then Matthias, maybe.
I'll do that quickly. So actually, I was talking to people in the state government here in Connecticut just about that. They say, how are we going to do this? There are many criteria. One I proposed is that let's not use the reduction in the level of turnover revenues as many countries are doing. Let's look at the growth trajectory of these firms in the last few years. Let's see the firms that were growing and those that were shrinking, because the level may be very deceiving. There may be large companies that were already shrinking. So if firms were growing, we should support them. If they were shrinking, probably we should try and help the workers instead and give them unemployment insurance and maybe help them to move. And that I would think is one of many, but that's an easy one. So let's not look at the level, but let's look at the growth, because that will generate jobs easily and relocate people quickly.
Very interesting. Thank you. Matthias?
Yeah, well, of course, a very, very complex question. Very often what happens is that you do help the companies with the most lobbying power. So this is something that should try and be avoided. I do think that ideally one should try and take advantage of the ability to help by putting some proper conditionality. In 2008, when Obama bailed out General Motors and Chrysler, he took advantage of that to have green conditionality. These are things that could definitely be relevant. I do think that indeed one question which is important is what is the future trajectory of the sector, not just the past one. Is some reallocation needed or not? I think there it's and I guess that's what Giuseppe was saying. It's something which is quite relevant in terms of the you do want probably airline companies to shrink to some extent. So in that sense, helping reallocation is helpful, which is not necessarily needed, not necessarily easy, but I think these kinds of things, for example, taking advantage of the fact that many low-skilled workers are out of work now to do some green investments that everybody agrees should be done would be an interesting way to go.
Thank you. Great. Matthias, I have a very practical question here for you. How is Danone enforcing social distancing between workers? Has this meant that the company needed to reduce the number of employees working, or are workers being relocated to different positions? How are you dealing with that?
There are two different situations. The first one has to do with the workers in the HQ. We have defined three different categories, three different teams, A, B, C, because in a building we can be only 1/3 of the employees, and we will start next week with this new organization. When it comes to frontline workers, we have already done that. With, for instance, we have no more collective briefing before starting their job, and we have at least 1 meter between workers in the production line. And this is something that was very important because we wanted to implement sanitary measures to be able to have the nutrition continuity for all the people all around the world. And we wanted also to protect the workers. Then there are two different categories of workers, but obviously our top priority is to protect our employees.
Michel, I think did you want to have a comment?
I have a question for Matthias. Did you implement some testing programs within Danone?
Yes, we are dealing with governance, and especially with the French government, because of the fact the food sector is a priority one. We wanted to be among the first companies to have a collective testing strategy. And for instance, I had a call with the INSERM in France 2 days ago to be part of a more global testing strategy, and we will be part of that. And this is something very important for us because we do know that it will be very strong for the government to have some samples of companies for testing, and it will be very important for us also for our workers. And we did that with the trade unions, obviously, to be very compliant when it comes to social topics.
A question for you, Michel, a little bit around just beyond testing. There's a general feel there's been a mistrust between citizens and government. Here we were with no masks. One day the masks were necessary, the next day they weren't. We destroyed masks in France. We don't have proper testing. There isn't a single market for testing, as you were saying. I know people in Belgium who've gone to France to get tests. You know, all of this has created a little bit of a mistrust between in the health and safety area with the government. How do you see that evolving, and has that had an impact, you think, today in the response of the government?
I'm convinced it has an impact. I think that, you know, citizens can understand much more than government are thinking. You know, when they don't have enough masks, they would say, you know, masks are perhaps not so useful. I can tell you, you know, I have many friends in Asia. The first thing they told me when the pandemic came here is, Michel, you have really to use masks because we know from experience that this is part of the strategy. And, you know, and people will say, we don't have masks, so we will not say, and it's the same for the test. People will say, yeah, but you know, with antibodies, you don't know if people are fully protected and so on, which is true. But at the end, you can explain what's the meaning of a test. People can understand that there is uncertainty. They can understand there are limits. And that's why I think that what you do at Danone is extremely important. I think that in a way, business leaders can compensate for what the politicians are not doing. I think that, you know, you can reinforce within the businesses, within the enterprises, the trust, also the trust in science, I would say.
Thank you all very much. We're 2 minutes over time, so fantastic. Thank you all of our panelists for joining us today. Thank you again to Frank and Michael for being the the organizers of this event, Giuseppe, Matthias, Luigi, Michel, thank you so much. Please do visit the Global GEC network. The video of the event will be available. And thank you so much to our participants. And I hope we almost took most of the questions. Thank you all. And we will be having you join our next event, which will be in a couple of months. Thank you.